Hello, my name is Dr. Robert Boostanfar of HRC Fertility here in Los Angeles, California. I trained at the University of California in Los Angeles to do my undergraduate training, and I went to medical school, residency, and fellowship at the University of Southern California. We want to welcome you to our clinic. Our goal is to provide the best possible care with the most compassionate team of doctors, nurses, and embryologists to get you the most successful outcome for your IVF treatment. ICSI stands for intracytoplasmic sperm injection. Approximately 1/3 of patients who come to our office for IVF are experiencing infertility difficulties related to the male partner. Specifically in these cases, the sperm will be processed and centrifuged, and several spermatozoa that are of the highest quality will be utilized for this microfertilization procedure. This is often done in conjunction with IVF for not just male factor, but also for PGS procedures where we are shooting for a higher fertilization and to minimize any DNA contamination from the spermatozoa. There are some cases in which IVF and ICSI are not necessary, and in our clinic we individualize that from patient to patient. Patients often inquire about the possibility of their in vitro procedure resulting in a twin pregnancy. When we take a patient through IVF, we stimulate the ovaries to produce multiple follicles, extract the eggs, and then undergo the fertilization procedure. The embryos are then cultured in the laboratory until day 5 or day 6 when they become a blastocyst. Some of our patients undergo PGS testing, and when we determine the quality of the embryos, we then will discuss whether we are transferring 1 or 2 embryos back to the uterus. In some cases, 2 embryos is a safe approach towards a pregnancy of either a singleton or a twin pregnancy. In some of those cases, approximately 50%, when 2 embryos are transferred, the resulting pregnancy will be a twin pregnancy. Some patients that present to our clinic may have antisperm antibodies. These are antibodies that may bind to the sperm head or tail and prevent good motility of the sperm. The IVF laboratory is specialized in several gradient centrifugation processes, which means they will take the semen specimen and cleanse the antibodies off of the spermatozoa by a simple centrifugation process. This will typically render the sperm free of any antisperm antibodies and to be chosen for the IVF process. Ovarian hyperstimulation syndrome is a very rare side effect of in vitro fertilization. In a small group of patients that are good responders, multiple follicles and egg extraction could cause the ovaries to become enlarged and have a little bit of fluid accumulation in the abdominal cavity. Newer techniques of stimulation that are used here at HRC Fertility, including a Lupron or a GnRH agonist trigger, in conjunction with an IVF protocol that uses an antagonist, have virtually eliminated patients having ovarian hyperstimulation syndrome, also known as OHSS. This is extremely important because many of our patients are traveling from China, and we would like to make their stimulation, retrieval, and recovery as pleasant and as easy as possible so they could return home 1 or 2 days after the retrieval without any complications.